Okay, well, now what I'd like to do is introduce our showcase presenter this evening, Jonathan Baugh, which rhymes with law, the founder of Dermanaut. Dermanaut is bringing to market the only electronic medical record application with a visual workflow for dermatology. They have developed a system that allows the physician to record the exam as it happens in a visual format, and the application will be delivered via a website as a subscription service. Ready?
Thank you very much, Diane. Good evening, everyone. My name is John Baugh. I have the privilege of introducing you tonight to Dermanaut, electronic medical records designed for dermatologists. Now, when we say electronic medical records, or EMR, we're referring to the clinical patient record. So when you go into a doctor's office, they pull your chart, that's the medical record. Well, there's a lot of news coverage right now going on about electronic medical records. The stimulus bill actually is going to allocate about $20 billion to help physicians implement electronic medical records in their office. Additionally, just last week, Walmart even announced that they're going to start selling an EMR product in their Sam's Club stores. Now, unlike the competition that's trying to commoditize EMR, Dermanaut's taking a different approach. We're building the only visual workflow designed specifically for dermatologists. Now, this unique visual workflow actually allows physicians to very quickly, very effectively, during their exam, record the visit. We've already been showing this product around in a prototype format to physicians across the country, and they're literally knocking on our doors asking for when it can be ready. So I'm here today seeking funding to take the prototype to the next level through a beta trial and product launch into the yet untapped market of $55.5 million annual revenue of dermatologic EMR. So EMR, about 10 years ago, the U.S. healthcare industry was actually growing at a pace faster than the U.S. economy. You can imagine what that looks like right now. Well, around that same time, the Rand Institute issued a report that said the United States could save approximately $162 billion annually if we kept all of our records, all of our medical records electronic. Well, the government read the writing on the wall and really tried to push that forward, but it wasn't until the stimulus bill recently got passed that there's that $20 billion carrot dangling in front of physicians to help them convert to electronic records. This deadline is really being set for 2014 to try and encourage this to happen very quickly, and ultimately this means electronic medical records are coming. Now, despite that, only 12.5% of all dermatologists are currently using EMR. That's compared to about 30% of all physicians across the country. Now, I already mentioned that there was that $20 billion carrot being dangled in front of physicians, but there's also a pretty big stick coming down the road. Actually, a 5% reduction in Medicare payments for physicians that don't comply with upcoming EMR standards. Now, I spoke with a physician just last week who said that 5% reduction is actually enough for him to shut his doors of his office. And it's not just implementing EMR that's actually costing physicians potential money, but bad EMRs cost money too. I've spoken to a number of physicians across the country that have lost tens, if not hundreds of thousands of dollars by choosing an EMR that did not work for their specialty. And the point is, specialists need a special EMR that fits the workflow, that fits the format of how they practice medicine. So what did we do? Well, we went out and we started talking to dermatologists at Dermanaut. This here is Gina. She's a medical assistant in a dermatology clinic. We met hundreds of Ginas. We went to their office, we spoke to them, we watched them keeping medical records, whether it was electronic or paper. We even put a lab coat on, followed them around the office, and really got to learn exactly how they practice medicine. Ultimately, we were able to design our prototype based on that workflow, and we found out that we really needed to have this visual workflow. Think of Google Maps for the skin. You can zoom in, zoom out, place markers where there are lesions, and even find old lesions, mouse right over them, very quickly and effectively get the data that you need as a dermatologist specifically. Now, why dermatology? Well, there's over 9,000 dermatologists in the United States. Dermatology is also one of the most lucrative of all medical practices. They actually see more patients than any other medical practice and see them in less time than any other medical practice. At our price point of $500 per month per provider, that's going to be a $55.5 million annual revenue. Now, the icing on the cake for this is really that the dermatology community is really opening their arms, trying to bring in EMR products that work for them. The American Academy of Dermatology is already doing several efforts on their part to really bring EMR to their offices. They have programs working with dermatologists helping them figure out how to implement EMRs. They have programs working with EMR vendors to try and get them showcased in front of dermatologists. And thirdly, they're starting up a new program which Dermanaut is trying to participate in, where actually the dermatologists and the EMR vendors can work together to build a product that fits exactly their needs. Of the hundreds of dermatologists that we've spoke to so far, we already have 7 lined up to be our beta clients who are absolutely waiting, ready and waiting for our product. Now, the carrot that we're all trying to get them to, their slice of the $20 billion pie, if you will, it's about $44,000 per physician. Well, we're not the only ones out there trying to help them get that $44,000. However, a recent 2008 report says that the research clearly suggests that there are many players in the market, but there are no dominant market leaders. Well, we compared ourselves to the so-called top 5 players in the marketplace. Now, as you can see here from the chart, we're the only ones that have a true dermatology-specific application. There are some that have templates, but really, what that means is their application looks the same for a dermatologist, cardiologist, or pediatrician. Again, that visual workflow is where we stand alone. Now, a lot of these companies also offer additional services such as practice management, things like patient scheduling and so on. We're not going to put that in our product initially, but we anticipate bringing that on by year 2. Interestingly enough, practice management, one of their high selling points, is not what's required to achieve their $44,000 of government reimbursements. Lastly, we've tailored our pricing model to truly fit a dermatologist through a flat, simple to understand pricing model compared to the complex negotiated contracts that our competitors are providing. Now, our business model is based on 2 approaches. One, we want to sell directly to the consumer, offer them support and backups and all the technical support that they need through software as a service website. And additionally, we want to rely on an existing relationship of dermatologists with medical IT companies. Almost every physician in the country right now has some form of internet and computers in their office. Well, a lot of them are currently relying on tech support companies to come in and manage those networks. We're going to partner up with those value-added resellers to really give us an additional support for the dermatologists that need a little bit extra support than we can provide. Now, the advantage of this is we can grow both vertically and horizontally, building add-on services, as I mentioned, practice management, e-prescribing, and so on, to our dermatology clients, as well as repeat this model in other specialties such as ophthalmology that need a very specific solution via EMR that is currently not being met. Our management team has over 10 years of experience in software design and development and support, as well as over 25 years of dermatological experience, both in terms of clinical and management. We are currently pursuing a lead developer candidate and are hoping to bring on a sales manager with medical IT sales by month 4 of investment. We've also received a tremendous amount of support from organizations like BizDemU, as Dan mentioned, GLEQ, New Enterprise Forum, and Ann Arbor Spark. Over the past 2 years, we've done a tremendous amount of market research to truly understand what the dermatologist needs are. We've done a pretty good job with our product design, got really rave reviews from dermatologists that we've shown this around to, and ultimately have our prototype and business model ready to go. Once we achieve investment, we're going to move into a beta trial. Again, we already have the clients picked out for that. Product launch by month 4, and we predict cash flow positive by month 16. We are currently seeking $645,000 of investment to achieve these milestones, and we see profitability by year 2. And as we continue to grow our subscriber base as a recurring revenue stream, we really see we have an option to exit through acquisition, either to an EMR company that is interested in moving into the dermatology market, or by looking at other data health companies such as Google Health with their data warehousing and Microsoft Health Vault and so on. So in closing, I would like to leave you with a few quick points. We're dealing with a $55.5 million annual revenue potential with this market. We have a unique visual workflow, something that has received great feedback from the market, and there's nothing paralleling it currently. And lastly, profitability by year 2. If you have any questions, I'd be happy to answer them. Thank you very much for your time.